So one of the better exercises that you can work on to prevent knee valgus or your knees caving in or knock-kneed kind of position is a squat in some way, shape, or form. So there's multiple different variations that you can do. Probably the easiest one to get started with would be like a barbell back squat. Or a front-loaded kettlebell squat, which I'll cover in a different video. So with this exercise, the barbell back squat, there's a couple of things that you want to pay attention to. So first is your hand position. You want to make sure that it's even on either side. Just a comfortable position. So a lot of times I'll use my thumbs to kind of measure how far out on the knurling I want to be at. And then I'll just grip the bar symmetrically. Okay. Once you have the bar gripped, you dip underneath and you want to rest the barbell on your shoulder blades. So you have a nice little bony spot right here on your back of your shoulder blade, where the barbell kind of just rests into. So even symmetrical hand placement, command to hold the bar right on your shoulder blades. You want to stand the bar up, and then you want to step back away from the rack. Okay. You want your feet just outside of shoulder width apart. You can be a little bit narrower or a little bit wider, but whatever's comfortable, typically just starting just outside of shoulder width apart. Okay. So from this position, this is your start position, you want to descend into your squat like you're sitting down into a chair. So a lot of times patients or people will, when they do a squat, they'll go up on their toes and they'll lean too far forward, or they'll go way back on their heels and they'll lean too far backwards. You really just want to break at the hips and then pretend there's a nice chair behind you that you're sitting down into. Okay. Now, as I'm doing a squat, I'm thinking about my feet. I have a tripod on either foot, my big toe, my little toe, and my heel. I'm trying to maintain even contact through all 6 of those points, 3 on each foot. I'm trying to maintain even contact through all those points as I'm descending into my squat. So as I sit down into that squat position, big toes touching the floor, little toes touching the floor, and so is my heel. And then I come back up. Okay. Another cue that I give a lot of folks sometimes is to think about your legs like they're a corkscrew. So as I'm descending into the squat, I'm driving my knees out just a little bit, still maintaining that nice even foot contact, and then coming back up. Okay. So with a barbell squat, it's a heavier movement. You can get pretty heavy pretty quickly. Anywhere from 3 to 4 sets of 5 to 10 repetitions. Typically going to a point of fatigue, but not failure with your technique. Doing that anywhere from 1 to 3 times per week.